any surgery that involves to be decreasing the size because of any reason, could be a cosmetic reason or a functional reason to be conducting the surgery, इसे हम labiaplasty कहते हैं. Hi, this is Dr. Avjot. I'm a consultant gynaecologist in Mulberry Women Care. I'm also a cosmetic gynae surgeon working in Mulberry Women Care, Sector 31, Gurgaon. So today we will be talking about a very interesting topic, which is labiaplasty. हम पहले start करेंगे कि what is labia. So the outer portion of the female genitalia, जो कि two outer lips जिसे कहते हैं बाहर के होठ, उनको कहते हैं labia majora. उन्हीं के beneath there is a thin pair of lip which is called labia minora. उसको हम labia minora भी कहते हैं. Beneath that, उसके अंदर ऊपर की तरफ हम देखते हैं clitoris and below is vaginal orifice. So when I'm talking about labiaplasty, that involves any surgery of labia minora, मतलब अंदर की तरफ, and labia majora, जो मतलब बाहर की तरफ के lips हैं. So I'll be talking कि ये surgery क्या होती है. What is labiaplasty? Any surgery that involves to be decreasing the size because of any reason, could be a cosmetic reason or a functional reason to be conducting the surgery, इसे हम labiaplasty कहते हैं. Who are the candidates जिनको ये सर्जरी ज़रूरत पड़ती है? कभी हमारे बाहर का जो पैड लाइक द labia majora that is big in size and that could be because of multiple factors, because of birth, because of childbirth, because of hormones, because of genetic factors. The look of it could be out of shape, वो शेप के अंदर नहीं हो सकती है, या फिर asymmetrical, मतलब उन दोनों की सिमेट्री सेम नहीं हो सकती है. In those candidates we perform the surgery and the labia majora portion. कई बारी अंदर के lips which are called labia minora, वो hypertrophy, मतलब they are big in size. Now they have the same factors as well. या उनका asymmetrical होना, इस चीज़ से परेशानी क्या होती है? Whenever you wearing tight clothes, तो आपको uncomfortable लग सकता है while you're exercising, and because आपस में थोड़ा सा friction create करता है while walking or while doing any exercise, तो वहाँ पर घाव या वहाँ पर चोट जैसा लग सकता है. In those cases there are females who feel very very uncomfortable while doing certain exercises. Also because of more asymmetrical shape and increase in size, कभी that kind of comes out and there's a chance कि हमको वहाँ पर infection ज़्यादा हो सकता है, especially fungal infection. So in those cases we perform the surgery as a functional surgery, जहाँ पर आपके everyday में या usually activities में आपको problem हो सकती है. कभी कभी cosmetic reasons that you're not very confident about how does it look, especially when it comes to majora and minora, or if the symmetry is odd. In those cases we can reduce the size, make it symmetrical. Mostly the size of minora and majora should be 1 to 3 centimeter for minora and till 4 for the majora. But definitely you will have to see a doctor. In any of these concerns, when you feel that it's too lax because of multiple childbirth and iska symmetry out ho chuka hai, so you can go and see your doctor. Let them take a look whether you would need that surgery, whether this would add to a functional cause or something that you would be more confident with. So iske benefits यही हैं कि आप you feel more confident, and in case if there are reasons like you're not able to wear certain kind of clothing, then you can. हम ये procedure कैसे करते हैं? So you called at the hospital and you're called after the examinations and certain blood tests very usual, like your blood group, your CBC मतलब आपका hemoglobin, and your viral markers HIV and HBsAg. If all of those reports are adequate, then you're called in the hospital 1 hour prior just to take your blood pressure and prepare your file. Then you should be changed. Proper cleanup of your area is done where it's properly shaved, and you taken in the procedure room. We give local anesthesia, मतलब usual सुन करने वाला injection, which is just one injection around the area that has to be operated. So that surgery takes around 45 minutes to 1 hour. एंड इसमें हम सूचर्स लगाए जाते हैं और ये सूचर्स डिसॉल्वेबल होते हैं. वंस वी गिव दो सूचर्स, ये यूजुअली 3 weeks लगते हैं, एंड बाय द एंड ऑफ 4th week दे डिसॉल्व. you don't have to come back for the removal of the sutures. In total, how quick can you feel absolutely fine is anywhere from 4 to 6 weeks. We discharge you after half an hour once everything is okay, because this is under local anesthesia, तो वहाँ के area उस time के लिए सुन होता है, but this sensation comes back after a while. You discharge with few antibiotics for 5 days, 6 days or 7 days, and you're given a cream ointment to apply, and you're usually called after a week just to check if everything is fine. Post, when you go home, please make sure that you take ample rest for that day, and after that you're supposed to have abstinence, matlab no sex for 6 weeks, mostly anywhere from 4 to 6 weeks, and that's when you start getting comfortable. We usually suggest to wear a thick sanitary pad for at least first week, so that there is extra cushioning and your stitch line and your clothes don't give you pressure once you sit. So that mostly is used for first week, and after that this is usually comfortable. The recovery doesn't take very long, and I'm sure you'll have a lot of questions regarding that, so you can drop down your questions in the comments and we will try and get back to you. Thank you so much.